health concern women don't worry about enough. Dr. Mark Alder from the Ogden Clinic says bone health should be at the top of our list. We hear about osteoporosis a lot, but just how likely is it that we might experience that in our lifetime?
Very common. The most likely reason that we have osteoporosis is because we're female and old. However, everybody has that opportunity, males and females alike. And there's a lot of things we can do to try and head that off before it's a problem for us.
Well, let's talk about the screening process. At what age do you recommend women start getting screened for their bone density health or osteoporosis?
We recommend that everybody have a bone density scan, a DEXA scan. Females when they're about 65. Males when they're about 70, and a lot of people do a baseline bone density scan in their late 40s to kind of help know if they need to work on their bone density and to get some advice on how to go about that.
It's a little earlier than I thought, in the 40s. Does that age recommendation catch some people off guard?
Yeah, it kind of does.
Yeah.
We kind of like people to think about it the same way you think about, colonoscopy or a mammogram. These are things we can do to make a little difference easy at an early point in your life that make a huge impact down the road.
Anytime we're asking about screening, I have to really dive in and ask about the process, because people hear the recommendation to get screened or get checked or get tested. Immediately they start to get a little nervous. What is that screening process like?
Typically it's really easy. You're going to make an appointment with your doctor. It takes about 30 minutes. The machine won't touch you. It's just like having an x-ray, except it's much, much lower radiation dose than an x-ray or even a mammogram. And then a report goes to your doctor and they can make some recommendations on what to do next.
I was going to ask about the radiation risk, but that's very, very low.
It's somewhere between 1/50th and 1/100th of the radiation dose of a mammogram, which is an extremely low dose.
Well, it's clear to see how important this test is, and like you said, it's not too difficult, it's not too intimidating or invasive. How can people schedule an appointment?
For us, they just call our clinic and we'll hook them up with radiology and make an appointment.
Fantastic. Thank you so much for stopping by. We appreciate it.
Thank you.
We will be right back.